Fentanyl has been used for severe pain since the 1960s, but it's also a major driver of addiction and overdose deaths. San Diego County recorded 320 fentanyl overdose deaths last year. Scripps Research chemist Kim Janda says his team wanted to see if they could make fentanyl safer by slightly redesigning the drug at the molecular level.
I decided to try to look at putting in a component that would basically be viewed as fentanyl by the immune system, but wouldn't have the liabilities that fentanyl has.
Janda says for decades, scientists believed you couldn't change fentanyl's structure without ruining how it works. His team changed what he calls the core unit of the molecule and tested the redesigned drug in mice.
That core unit looks like a honeycomb in shape. And what we did was we changed it to look like two squares that are hooked together like paper clips. And surprisingly, we found that it still has the ability to block pain, but it doesn't cause respiratory depression.
Respiratory depression is that dangerous slowing of breathing that makes fentanyl overdoses so deadly. Dr. Richard Clark is an emergency physician and director of toxicology at UC San Diego Health. He treats fentanyl overdoses.
The higher the amount that you inject in yourself, the quicker you're going to stop breathing. It's potential that you could stop breathing within minutes of a large dose of fentanyl.
Clark says if a new version of the drug truly reduced that breathing risk, it could make overdoses less deadly.
My takeaway would be this research is fascinating. And if it actually holds true in humans, it has great potential.
The research is still in early lab stages. Janda says his team chose not to patent the research, hoping others will build on it.
In a sense, it's a makeover of fentanyl, which people think is this monster, and we're trying to make it more tame in terms of how it could be used as a therapeutic.
Janda says the research could lead to next-generation opioid medications designed to lower the risk of addiction, overdose, and death. Heidi de Marco, KPBS News.